Yeah.
Manuela, while we're doing that, can you call Valeria? Can you just mute for...
I'm calling. Yes, I just called her. She's
Yeah.
trying to.
Valeria is in delay.
Yes. Okay.
Perfect. While we're doing that, you call Valeria. Can you just mute
I'm calling. Oh my gosh. Call her. She's trying.
Okay. Well, it's okay, Sandro. So good evening, everybody.
Good evening.
And
Evening for the Europe, but hi for all the.
1 second, let me just mute my own YouTube stream. Otherwise, I'll be causing us echoes. 1 second. That's better. Now I just put my sound back on. As you can tell, everybody, we're a very natural and beautiful live stream. So thank you to everybody for joining us on such a beautiful and sunny evening. We are excited to welcome everybody to this live stream tonight, talking about the Lipedema World Congress in Rome. We are incredibly excited to be going into our second World Congress and to have it in such a beautiful city as Rome in such an auspicious year, which I know is a wonderful outcome for many of our members. And what we want to do tonight is give you a little bit of a briefing from Sandro Michelini, who is here with us, who is one of the Congress chairs and also the president of the Lipedema World Alliance, which is a great blessing to us to have somebody as experienced as Sandro with his many, many years understanding around lymphatic systems, around research in lipedema, his networks, which are incredibly extensive. And I must say, on a personal note, as a patient representative within the Lipedema World Alliance, I treasure and appreciate the consideration Sandro shows to our voice and our experiences. So I'm delighted that tonight we will be able to give all of you who are with us an understanding about that and give you some indication about the Congress. So the format of our session tonight is that we are incredibly lucky to have, as I said, Sandro Michelini, our president, here with us. So in a moment, I will ask Sandro to introduce himself. And then after that, after we've done our introductions, Sandro will go into a presentation about the Congress itself in Rome and what to expect. And then we'll talk after his presentation a little bit more about the role of patient associations and patient representatives in the Congress. And we'll explain a little bit about why there are 3 of us here on the call tonight. So I think, and then we'll take questions and answers. So we would encourage you, it's a live stream, so please type in the chat your feedback, your comments, your questions, your thoughts, your advice for us. Something that's incredibly important to Lipedema World Alliance is that together we can beat lipedema. So we really do appreciate every bit of feedback that people have for us, because that's what's going to help us see the connections, make the change, and be the difference that we want to be. So before we get into the presentations, I think if it's okay with you, Sandro, we'll just introduce ourselves as the patient representatives on the call, then hand over to you to introduce yourself and do your slides. So for anyone who isn't used to my beautiful English tones, I am Kate Forster and I am one of the patient members of the Lipedema World Alliance board and one of the board founders. And I am a board member at Lipedema UK. And I am super lucky to be here with 2 of my best friends tonight, Valeria and Manuela, who are really, as 3 organisations, Lipedema UK and Linfa in Portugal, where Manuela's from, and Leo Lipedema Italia, where Valeria is kind of calling in from, if you like. We were so lucky going back, when we think back into the pandemic and into kind of the start of where we were, we really came together with a group of professionals like Dr. Michelini, talking about lipedema and about how could we do this in an incredibly connected way. and it's been one of the most amazing experiences, and I can't wait to grow our family in Rome. So, Valeria, could I ask you to introduce yourself briefly and tell us a moment about Leo before you hand over to Manuela?
Thank you very much, Kate. Thank you, my friend. And Lipedema Italia exists since 2018 with the main objects of having lipedema known and to raise awareness on lipedema in Italy and abroad, and to have it recognized by our national state system. You know, we as a national association share the same problem all over the world with the recognition of the disease. You know, that patients have to pay for everything. And so we are trying to do our best to help patients, raising their awareness on the disease and also to help them to have it fully recognized by our national state system. As for me, I've been running Lipedema Italia in the past 6 years. Then now I'm a volunteer taking care of our advocacy activities and our scientific events like congresses and our scientific contribution. And I represent Lipedema Italia in the board of the LWA. That's it.
Hello, my name is Manuela. I'm from Portugal, and we are here working for lipedema as well for the patients in Portugal since 2015. So we are trying to do our best as well. As any other countries, we have also the same problems. So that's the reason why it's so important to be together. And the Congress will be also very important because like that we can share our things and our not any caps, but almost there, and to come together with one voice and trying to find out the best. I'm very, very happy to be here with you, Sandro, and just explain us, please, what about the Congress, what we are going to do, and why it's so important to have the patients with you. Thank you.
Thank you very much. Hi to all the presents. And thank you for your presentation, Kate, Valeria, and Manuela. This is a very important occasion to explain how we are working to realize this meeting in which we will share our experience, but not only among the scientists, the health professionals, but share our experience above all among health operators, health professionals, and patients, and association patients, and association society, and scientific society that compose Lipedema World Alliance. But before to speak in particular of some aspects of the Congress, I would like explain you some aspects if is active the sharing of the slides. Do you see the slides?
It's perfect.
I would like start with some comment regarding this illness, this disease. Why, for example, it is only now that lipedema is being talked about more and more forcefully through the international scientific community. Yet the disease is obviously as old as men, we can say. Why have we been so distracted by it until now? We must remark this concept is an important concept. It affected by the disease about 10% of females in the world, still underestimated because it is not recognized in more cases still today, or confused with other diseases with a wrong therapeutic approach. And this is a problem for patients. It is hereditary, but various factors contributed to the genesis and development of the disease. Back in 2011, when I was president of the European Society of Lymphology, I submitted a formal request to the General Director of the Society of the World Health Organization for recognition of the disease, accompanying it with the little but already significant literature that supported our proposal. And in 2015, as president of the International Society of Lymphology, I reiterated this proposal. But in 2019, I organized a meeting in Geneva at the headquarters of the World Health Organization with a specific commission, helped by some European colleagues. For example, Isabel Forner-Cornero was present in this occasion, to better explain the characteristics of the disease, also in the light of the researches that were proceeding in the meantime. And finally, in the year 2022, the World Health Organization included lipedema among the diseases recognized in the 11th edition of the International Classification of Disease, with its own identification code. This is very important, a very important step for the disease. The same year, 2022, saw the birth of the Lipedema World Alliance, which is about to celebrate its first 3 years. The Alliance was founded with the aim of correctly addressing information concerning this disease. Many aspects of the disease are still controversial and subjectively interpreted by doctors and scientific associations. As you well know, there is a shortage of reliable and evidence-based medicine compliant clinical trials. It is not just a particular form of obesity, but a set of complex clinical pictures requiring multidisciplinary intervention. There was much disagreement between the various think tanks on many substantive issues that needed to be addressed and resolved with a rigorous scientific method and with the active participation of patients and the association representing them in continuous discussion with clinicians and researchers. In this slide, you can see how the founding members included people from many countries and especially health professionals, patients association and scientific association to work on a common project. Here you can see the origins of the members of the first nucleus of the association. The concept was gaining ground that lipedema is a disease in which pain is one of the main symptoms and not merely a cosmetic problem, as had been judged until then by the international scientific community. This is a very big problem, a very illness, a very disease. So that the aims of the association are the standardization of diagnostic and therapeutic indications to promote the recognition of the disease from the health, public and private sanitary systems, above all after the official recognition by the World Health Organization, promote the awareness of the medical problem, the preparation and qualification of healthcare professionals managing in clinical cases, and to encourage the promote clinical and experimental researches. At the first World Congress 2 years ago in Potsdam, some of you were present, the association developed and discussed a Delphi project, which is about to be published in which many experts agree on a number of fundamental points that should be acknowledged and as supported by a large increasing literature. The representative of patients association also actively participated in the project and contributed their expertise to the final draft of the document. And so we come to the Second World Congress to be held in Rome next November. The venue of the Congress will be pavilion number 10 of the new fairgrounds in Rome, a new facility located near Fiumicino International Airport, very functional and technically well equipped. Here you see the pavilion as a wall, and this is the main hall of the pavilion, which we will call the auditorium, where the main sessions of the Congress will be held. 2 other rooms will be reserved for the presentation of oral or poster communications and for holding workshops. For accommodations in the vicinity of the venue, there are several hotels with all the comforts one could need. This is the scientific committee of the Congress, of which myself and my friends Karen Herbst and Moshtaba Gods are the coordinators. And this is the organizative secretary that you can consult at any time and for any kind of problem related to the program or logistical aspects. In order to be able to adequately follow all the conference proceedings and easily participate in any discussion in the auditorium, we are preparing a simultaneous translation service that will certainly include Italian and Portuguese, but we plan to extend the service to German and Spanish as well. Here you can see the draft of the program of Congress, which will take place mainly in the morning and afternoon in 2 different rooms. The first day of the Congress, the 5 November, will be devoted to some videos, live or recorded, illustrating the work of some of the participant teams. And in the afternoon, there will be an important meeting between the Patients Association, where they will be able to plan common strategies to complement the activities of the association. On the first day, the work will take place in the Aula Magna of the San Giovanni Battista Hospital, an Italian hospital of the Order of Malta, inside a Renaissance castle that was one of the seats of Pope Julius II della Rovere. The hospital is very close to the Congress venue. The second day, 6th November, in the auditorium, reports on the following topics will be presented. As you can see, the basic science, very important, and the genetic, the biochemics, and so on, other experience developed in the last years. Epidemiology and clinical research is very important, and lipedema and comorbidities, a topic very important to deep. We are planning similarly to what was organized in the first Congress in Potsdam, introductory lectures and the presence of at least a patient's association for each session. On the third day, in the auditorium, we will discuss the conservative physical therapeutic approach, nutrition in lipedema, other topic very important in which we must discuss more and more, guidelines and consensus documents, and how to measure lipedema, another important problem that daily we are present during our activity. During the fourth and final day, surgical treatment in its various aspects, the use of drugs, just for say, for example, the big problem of the GLP-1 molecules, analog of GLP-1 that have some positive, as maybe also some negative effects on the patients, and we must discuss and deep in the right way also this problem of the drugs in lipedema. The future lines of research also is important, and to conclude, in the second afternoon of Saturday, 8th of November, the General Assembly of the Association. But during the Congress, other important aspects will also be discussed, such as the topic of physical exercise, which is still partly controversial, clinical and technical workshops, and the monothematic symposium will be organized. Regarding the Congress, other important aspects will also be discussed. For example, the physical exercise. We will try to focus on when, what, and how much it is appropriate for the patients to do during the day, because till today this is another big problem. And the workshop dedicated to the clinic will allow expert colleagues to pass on their experience to others, and especially to the younger participants who will dedicate themselves to the study and the management of the disease. Like, for example, our friend José Simarro, or our friend Karen Herbst, with a very important clinical experience to transmit to the young, above all to the young, but also to all the professional and not the health professional participants. But aspects regarding the use of some device useful in the analysis of the single clinical case will also be discussed. You can see, for example, the ultrasounds, the elastosonography, the bioimpedentiometry, and other device very important to support the clinical aspects and to determine a right diagnosis in all these cases. At this point, you will ask me why participate in this Congress. My answer are three, and are these: exchange of knowledge by scientists from all over the world, coming from more and more countries, gathering patients' impressions and investigating problems, taking stock of progress in scientific research and outlining new developments of the research, sharing experience of outlining custom documents. I received in these months more proposals to discuss during the Congress from important not only foundation but also association, and by some single health care professional. And the last but not the least, visiting a city like Rome, which offers many interesting ideas for a pleasant and enriching stay. Yes, because Rome awaits you. It is a welcoming and a lively city, ancient and modern, cosmopolitan like many other world metropolises, but also very respectful and intimate if you manage to grasp its true cultural, artistic and human essence. See you in Rome, and thank you for listening to me. If you have some observations, some questions, some aspect too deep, I'm available to speak of this about you.
Thank you, Sandro. That was adorable. We have already had someone asking in YouTube about the detailed presentations. So I have reminded them that your deadline for abstract submissions is about 2 more weeks, I think. June 30th is the current deadline for abstracts. And I've shared in the YouTube chat the link for that. So you might get some more people contacting you about abstract submissions. Maybe.
Yes.
We shall see. I think that's the only question we have at the moment. Let me just look back again once more into the chat on the YouTube. Oh, okay. We also have another piece of feedback, Dr. Michelini, from Dr. Nadiv Shapira, who would like to make sure that we, in Rome, put the posters in a place with really good visibility to people who are walking around, because they felt that in the first Lipedema World Congress, the posters were maybe a little bit out of the way. So I'm sure that you will definitely take that feedback on board and make sure that everyone can see the posters, because there's always so much to learn from those. And whether they're early researchers or other people, they're always very interesting, aren't they?
But under this point of view, I think that we can change also some rules, traditional rules. For example, I just invited to speak, for example, a personal trainer, because this is a figure very important for this kind of patients, more young in the majority of cases, and more of personal trainer have not knowledge. There is a misunderstanding very important of the disease and the possible effects of the physical activity on the body of these patients, above all of a lot of patients. It's very important that also the manager of this aspect of the fitness in these patients must know the illness, must know the disease, because in more and more cases, I personally, during the clinical examination of patients, solve, there are some physical involvement, an approach of physical activity very incorrect for these patients. And this is important also for the health of patients, of the same patients. This is an aspect different, just to introduce also these aspects that are important, collateral but important for the management, the holistic management of the clinical case.
Thank you, Sandro. That's really helpful. I think they are our current questions. Oh, yep. We have some very specific feedback about the posters. What we'll do, Dr. Shapira, is we'll make sure that we capture that from the chat tonight, so that Dr. Michelini and the others for the Congress can take it into account in the layout, to make sure that we get the maximum visibility. I think it'll be, it sounds like Dr. Shapira definitely wants to make sure nobody misses out on seeing any posters at the Congress. So I know that Dr. Michelini will make a great job of that.
Yes, but question is my question for you.
Mhm.
How you must explain how the patient association can contribute to the
Perfect.
realization of this important meeting.
Thank you. We would love to do that. So I will just, we have a few.
I remember you that the same World Health Organization recommended, starting from more than 15 years ago, the maximum collaboration between the scientific societies and the patient association. Above all, for the component of the position paper, the consensus documents, guidelines to save the health of patients.
Yes, thank you. You're very kind, Dr. Michelini, to give us that opportunity and that beautiful question. So we've prepared also a few notes for people to explain the role of patient associations in the World Congress. And just before I do that, I think you have given us a wonderful introduction in talking about the World Health Organization's position on the involvement of patient voice and patient experience, because that was something I think that both we as associations and the healthcare professionals and researchers like yourself, Dr. Herbst, Dr. Simaro, Dr. Godds, Dr. Corneli, Dr. Ferber, Dr. Fauna Cordero, and anyone else from our board that I've forgotten, Dr. Krupa, and there's probably someone else I'm mortally offending, but I'm sure they'll forgive me. So when we came together to found the Lipedema World Alliance, we had a really strong vision that some of the things that people were thinking or saying about lipedema were very divorced or separated from the voice of people whose lived experience is living with lipedema. And I'm always very conscious when I think about that, about a presentation that I went to where one of the professionals who treats patients with diabetes said that when he sees his patients, he doesn't even see them for 1% of the year. They have a few appointments. They spend 99% of their life living their condition. And that's something that we as patient associations are very conscious of. So looking back initially to the World Congress, the first World Congress in Potsdam, we had a similar setup of a day one patient association, networking, collaborative project day. And what was really nice about starting off in that way, and we're delighted to be doing the same in Rome, is it gave the opportunity for lots of different professionals to come and spend time with us, networking and discussing projects. We also had space set aside for patient representatives and associations. So it meant there was an easy space for people to find us, and also that we had a space, so people who were struggling had a space to sit and rest and have their meetings, so we could continue to network and continue to dialogue while managing our own health. And we also worked together, both organisations like Leo, Lipedema UK and Anlin for ourselves, with associations like an LNet who were coming to the conference, who were newer to collaborating with us, to Amalf from France, who's one of our members. So we brought people together to think about what we were going to do with the sessions at the main conference and to look at bringing in patient voice. And the way we did that was that we had these 12 thematic groups or sessions. So as you've gone through tonight for us, Dr. Michelini, the key scientific themes of the conference, each one of those we introduced with a session from a patient representative. And they had a 5-minute introduction on each topic, whether it was the genetics of lipedema or nutrition and ways of eating. So we heard from people in various different countries about projects their organisation was doing, whether it was Lipedema UK surveying people on their ways of eating, to an LNet talking about how people perceive pain and what it is to feel pain. And by having patients introduce the topics at a Congress, to introduce every topic at a Congress, we got a lot of different feedback from people. And we also had people's feedback going into the ears and into the minds of the people attending the Congress, so that the questions they brought up and the lens through which they experienced the scientific and technical content had been shaped, we hope, by our feedback and our thoughts and our questions. And then the presenters and session chairs, like yourself, Dr. Michelini, like Dr. Herbst and Dr. Ferber, were able to pick up on, in their questions, the connection between what the patient representatives had shared and what the scientific and clinical presentations covered. And something that I'm particularly proud of is we were able to help people speak at Congress who hadn't done it before, associations that were newer, and where people weren't sufficiently confident to do that in English, even with extra support. We took feedback on all the different topics and provided that to different presenters. And then I worked with some of the people to say, in your presentation, can you also reflect that there's this other feedback from a different country and a different patient group? And this is a question they'd like to see addressed on that topic. So we tried to be really inclusive in that. And we definitely need to build on that and keep doing that better. But it was lovely to help people give their first speeches on a conference stage. I think that was a very special memory, and we can't wait to have some of those friends come back and do it again, and some new friends give it a go in Rome. So for anyone who's been excited about how we did it, what it looks like, you can go to the website for the previous World Congress, which is lipedema-world-congress.com/on-demand/. We'll put that in the chat. And you can see, as my high quality skills show here, one of the patient association presentations. It's up there with all the other scientific videos. And you can see all of us and hear what we had to say. They are preserved, they're freely shared, and they are finished and presented just as well as any other scientific session at the Congress. And it was a great opportunity to raise awareness. So when it comes to the next Congress, what are we going to do? So Rome is a yes and model. We have shared with you tonight some of what we did. We think those things were powerful, and we're delighted that in collaboration with Dr. Michelini, we have the opportunity to repeat those and to try and go further. Because the Lipedema World Alliance is about making a difference, so we need to keep raising the bar on ourselves and our vision about what's good. So we will look to include more feedback from other organizations. So probably after the abstract submissions close, as some of the details start to get finalized around the sessions, I and my colleagues will be working with Dr. Michelini on how can we really strongly connect what our thematic introductions will be with the sorts of content of people's presentations, and how do we create those connections between associations and researchers. So as I guess one of our encouragements would be for patient associations who are thinking about coming to Rome, go on the website, book early, because the sooner we know who you are, the sooner we're able to make contact with you and involve you in some of our conversations about the event from a patient association perspective. Hopefully, and I'm being ambitious here, but Valeria and Manuela, along with our colleague Shari from Lipedema UK, we're all crazy ambitious people. So what we want to really do is take what we did and keep those wraparound connections, build more before we get there, and then keep more momentum going afterwards. I've put a reminder about the Lipedema Manifesto that we published last year, which is endorsed by the Lipedema World Alliance, by a whole host of associations, not all of whom will make it to Rome. So I really want to make sure that all our partners and friends are able to help bring that patient voice to the Congress, so that those of us who are there can provide that feedback and input for those who can't be with us. And somehow, in a world that doesn't involve ruining the planet by wasting trees, I want to make sure that we're able to share materials and information with attendees at the Congress so that we're promoting the work of associations. And at that point, I think it is hopefully a moment where Dr. Michelini will forgive me for mentioning one of the Lipedema World Alliance projects, which is to form a library of materials, which may be scientific publications, they may be clinic manuals or documents, patient guidance, also patient association surveys and leaflets, and key articles that any of us have published on our websites. They don't have to just be correctly Harvardly referenced journal articles or things you find in PubMed. So for members of the Lipedema World Alliance, there is an opportunity to provide those publications to us so that they can be put into our EndNote library and shared out with all our members as a great resource. So we're really excited about that as associations, because for us, we're generally mostly volunteers. We have ambitions this big and kind of budgets this big, and maybe volunteers in time that are this big. So we really, not all of us writing the same leaflets makes so much sense. So we're super excited by some of the benefits we'll glean from the library, or the inspiration we'll get for different resources and publications. So if you're a member, send your stuff in. And if you're not a member and you're in lipedema, you're an association or you're a professional, join us, because there's so much good we can do together. And I think that is probably the point where I have, I guess, covered, I hope, most of what my colleagues and I wanted us to talk about. So at that point, I will close my slides.
Yes, if I can, Kate, thank you for your presentation, for all your words, very interesting. But I would like suggest you and to all the patient association, if possible, during this important occasion, for example, the first day in the afternoon, to discuss also of the progress regarding the recognition of the illness in each sanitary, public and private system of each country. This is important, and above all, which kind of strategies in various countries you adopt, you are developing to obtain the official recognition. For example, in Italy, I give you our example. If possible, that within the end of this year, the illness will be incoming in the essential level of assistance, with a guarantee of the assistance, at least the minimum assistance to these patients. Still today, the illness is not recognized in over the world, because the World Health Organization recognized the disease only in the 11th edition of the International Classification of Disease. In over the world, in this moment, there is a maximum the 10th edition applied in the practical management of the health in the various systems. In Italy, there is still today the 9th edition. In the United States, in some European countries, there is the 10th, but 11th is not in any country. And this is important to promote also the we obtained, maybe, but I hope is very possible in Italy, that some disease included in the 11th edition can be transported in the 10th, and within the end of this year, for example, in Italy, we will apply the 10th edition with including also lipedema, for example. Explain the possible strategies that in this kind of we can with this possible ether also keep some ideas for the efficacy strategies to obtain the recognition at a minimum level, at least of recognition for these patients that still today, as you know, have in charge some fees, some costs for the proper health. This is a possible topic to develop in this occasion, I think.
Yes, you're right, Dr. Michelini. There's so much variation in different countries in the adoption of which version of the ICD code people are operating to, how it's funded, how lipedema treatment is funded, or what is and isn't funded by insurances. So strategizing together on where we are, sharing examples and helping each other bring all our countries forward is definitely a great topic of conversation for our first day. So I know we look forward to working with you to take our big ambitions and bring them down to an agenda that fits the day, and then publishing that to our association members in due course.
Yes.
Valeria, in terms of the sort of as the sort of local hosting, is that a good point for you to speak about the Congress? May I ask you to do that?
Yes, thank you, Kate. There is just a couple of information that I want to add on the benefits of the people that are listening to us on behalf of the local organizing committee. We have received some messages about some patients concerned about their location, the accessibility of the places. The only thing I can say is that the local secretariat is doing our really best to have everything accessible, to have some seat points for the patients to take some rest, elevate legs, to have seats that can be suitable for our big parts, let's say like this. And I think we, as Lipedema World Alliance and the organization of the Lipedema World Congress, we can do really our best to have all the patients felt seen, and we will take care of everyone, trying to organize everything at our best for patients to enjoy this experience locally. And Kate, let me just tell something about your the amazing job that you did 2 years ago in Potsdam, in gathering together all the patient associations for the Lipedema World Congress 1. And I really know that we will do the same together for this new edition on your guide, because you're a super gatherer, and we can maybe establish a committee about this, so we can collect all the needs from our sister associations in the LWA, founding members and members. So now the organization part has been more scientific for the abstract, etc. Now I think it's our turn we have several months from here to November, and we have all the time to organize everything to make the miracle that you made 2 years ago, thanks to your ability to gather people together. We want to do the same, And so, because it's important, let me just, I will take you just 1 minute. The importance of Lipedema World Alliance is the word together. You know that I always, when I speak, I always stress this because together is our keywords. And so in the Lipedema World Alliance, we managed to create something that is really going towards the evidence-based medicine with all the three parts of the evidence-based medicine. There are the best literature ever, the best healthcare professional experience, and also the third part that is sometimes neglected or forgotten. We represent the voices of the patients. That is an essential part of the evidence-based medicine. And so we are proud to represent this, and we will do our best to have the patients' voices heard in the Lipedema World Congress. So I'm really optimistic about this, and we have a lot of work to do, but we are not scared about working like this, and that's it.
Thank you, Valeria, for speaking on behalf of the hosting organisation. And you're right, we have more than enough aspiration and excitement. We just have to now continue to organise ourselves to make all the precise decisions around the event. We had a wonderful time in Potsdam, but I know Rome is going to be even more amazing and powerful. We have a couple of questions in the chat, and if I may, I'm going to cover a couple of them, and then I have a question that I know either Valeria, you and or Dr. Michelini will love to take for us. So a couple of people have asked a little bit about the Lipedema World Alliance and about whether patients can join it or who joins it. So I hope it's okay if I explain that. The Lipedema World Alliance is set up to be an alliance of researchers in lipedema, whether that's early career researchers or people with a longer tenure, scientific associations and organizations carrying out research in lipedema, healthcare professionals, whether they are professors, doctors, nurses, physical therapists, MLD therapists, a whole host of professional backgrounds are appropriate for professional membership. And then we have membership for patient representative organizations. And that is important to us that it's patient organizations. So we have the mirror of organizations of people living with lipedema and scientific organizations, but we don't have a mirror to the healthcare professional category. LWA is not an organization that people living with lipedema can join directly if they are not running a representative organization. Whether it's a national or a regional organization, it needs to be a grouped activity. And that is important to us for two reasons. One of which is we're really excitable, passionate people, and we make great friends and we love them. We don't want to stop them being great, powerful, passionate people. To Dr. Michelini's point about how do we change the care that's provided in different countries. We need to be national ambassadors and champions. We need to be working with our professionals like Dr. Michelini to change people's lives where we're living, where we're breathing, in the systems that we know, where we can go and be powerful. So we didn't want to stop that happening by sucking all those people into LWA and not having vibrant organizations. I'm from Lipedema UK, and our big survey, which took place over roughly 2012 through 2014, it took us a couple of years to get 250 women to respond. One of the last surveys we did, we got that in a couple of months, something crazy like 2 months, because we're building our networks and our reputations. And we don't want to take that away. So we don't think it's right for us to take individual patients in and compete with regional or national organizations. So if you are passionate about our work, please, if you look on the links that we've put in the chat, then you can see whether your relevant organizations are part of LWA, and for sure, if they're not, tell them to get in touch. There's a little become a member button on the website. You get them to click it, get them to fill it out, get them to engage. Maybe you want to become part of their organization and offer to be their international rep. You do you. You're very welcome. All our friends, lipedema brothers, sisters, whether it's caregivers, men or women living with lipedema, are all welcome. But it's through that route, because we think we need to support that vibrant grassroots, not compete with it. And also then not compete with it, you know, in terms of like membership and subscriptions. And also, the other thing that's really important to us is by being in associations, we have a level of governance and accountability. So in the same way that if somebody thinks Professor Michelini makes very unwise and strange statements, they could report him through the Italian healthcare structure because he is a professional. By running an association, there is some governance around what we do, where our money goes, what, you know, how we behave and conduct ourselves. And we think that's important because then when we're encouraging that local networking, it's easier for health organizations and insurance bodies to deal with a formal organization than random individuals. So I hope I know there were a number of different people asking 3 or 4 questions in the YouTube chat that covered parts of my answer. I hope that makes sense to you, and I look forward to seeing some additional organizations joining us. And I'm very happy to say that one of the questions about do we work with Brazil? Well, we had, I must say, our member organization Abrali, the Brazilian Lipedema Association, and organizers of the first cross-Brazil Lipedema Congress. We had them presenting for us 2 nights ago on the amazing host of things happening in Brazil. You can see that in this YouTube channel, in our other recorded live streams. Please scroll up, down, left, right, whichever way your website phone works, and you'll find a wonderful session with Dr. Federici, who's in our chat tonight. And I'm sure if anyone has any questions about Brazil, she'll be happy to pick up on them. So that's my advert, unadvert. I have a question now, which is about Rome, which is, how far is the Congress venue from the city of Rome? Because visiting Rome and not visiting the beauty of Rome would seem like a terrible thing to do. So perhaps would Valeria and or Dr. Michelini, would one of you like to explain a little bit about the physical travel and logistics?
Yes, it's not a big problem, because the Fiera di Roma is very near to the train station, and by train station with a 15 minutes, I think, we are in the centrum of the city. It's very, very near, very, very easy to keep but we must follow the session of the Congress. We will have also an adequate space, also, of course, for the possible amusement in French. But
Dr. Michelini, you say like this, but we know that you are a super host.
Kate, I would like also to underline another concept. It's very important in this Congress, next Congresses, but starting from some years ago, we will insist on this way to speak not only, not exclusively of scientific aspects, but also of these organizative and social aspects during the Congress. And for a success of a manifestation like this, is very important the cooperation. All the important fight must be conducted together. Professional health professionals, sanitary operators, patient association, scientific association, and also the companies involved in not only elastocompression, but for example, all the surgical procedures and the drugs and so on. It's very important to cooperate. For example, in the last years, last 15 years, we cooperated more and more with some companies also to obtain by the private and public insurance some aspects very important. For example, garments, for example, some kind of physical therapies, obtain for to help these patients. More and more for lymphedema patients, but starting from some years ago, also for the lipedema patients. This is very important. The cooperation also with all the actors included in this important fight to defend this kind of patient. And also the companies. The patient association is basilar because we do, for example, in Italy with the Valeria, with the Lipedema Italia Onlus, we obtained also some important aspect relative to the assistance from the Ministry of the Health, and we are obtaining also in this moment the official final recognition. This is basilar, the cooperation, to well understand patients, health professional patients, and both also the need of the companies and of the public institution that have another point of view, of course. But we must cooperate to do with enthusiasm to obtain with the fight these benefits for all. For all, not only for the patients, but also for all that we manage with patients, with the health of the patients every day.
If I may just add something about the social program, because of course we are struggling with healthcare professionals because they always want everyone focused on the scientific activities of the Congress, but we want also that people joining us in Rome will have fun and enjoy the city. So everything will be done to have the best social program we can with the help of the supporters. I think we can do our best also to try maybe to gather some resources to stream the Congress, but this is not a promise that we can do it now, but keep an eye on the social media of the Congress, but because we will do our best also to manage to do something like this. The social program, I think, will be amazing because you will eat very, very nice and tasty and delicious Italian food. And don't trust Dr. Michelini, because Dr. Michelini will have you have a lot of fun in this.
Provide also for this aspect, we will provide.
It will be a surprise. He will surprise us, Dr. Michelini. They will know your funny part also.
Very good social program.
Indeed. And I'm delighted to say that Dr. Shapira promises that his visits to the city will not be during any of the Congress sessions. So now that he's said that on a live stream, all of us will be looking for him in every conference session. So I'm afraid, Dr. Shapira, you will have to have 100% lecture attendance now. But I appreciate you reminding people that to visit Rome is a wonderful opportunity. And if people can come a little before the Congress, the first day will have some great content. So maybe if you're coming in the night before the 5th, come and join us. I'm sure we can organize some wonderful social activities and learn from each other and make some of those wonderfully valuable connections.
But we will realize both the aspects, scientific and the social.
We will. I think, Valeria, you had a couple of other thoughts you wanted to share as closing remarks, because I think we've now covered all the questions that we had in the chat.
Yeah, actually, I would like maybe Manuela to share these thoughts if you want, because this this idea came from your thought of gathering together patients in this Facebook advocacy page. This is your idea, and I think, Manuela, you can share it with us if you want, of
Yeah,
course.
okay, I can share, but all of us can speak about this because it's very, very important to stay together and give a word together, not only from Italy, Portugal, or Britain, but all together we can do it. So it's very important that we stay together. And as Kate said, it is very important that all the patients try to find out an association in each country, because a voice without an organization is not a voice, official voice, and we have to move and to think about everything. And as Dr. Michelini said, we have to change also the policy in each country, which sometimes is very, very difficult to do it. But if we stay together and if we have that voice together, we can do it. So that's my main point. And I think we had a wonderful time, for instance, in Brazil, and trying to find out all the things that we can do together. And I just want to underline and invite all the associations to be in the Congress, because like that, we can work in the next steps of the policy and what we have to do together and to change the answers in lipedema. That's the main thing. But I don't know if you want me to add anything more. But my main thing is go to the association on your country, stay together with with them, work with them, and then the association for it stay in Rome and work together with us to change the policy. And it's important to have an answer, a very good answer in all the healthcare um, countries in different countries, because we have to have the answers. Otherwise, the patients are completely alone, and it's not the best. So we have an opportunity in Rome. So let's do it together, okay?
Thank you, Manuela. And I think, Valeria, you've got one or two more things to add briefly.
Just one simple thought about what happened with the World Lipedema Day, because I think that this is a good example of how some crazy patients having ideas at night can change the world. Because the 11th of June that became the World Lipedema Day was born during a night with the three of us and Sherry, and I don't remember who was with us, just to say, okay, lipedema doesn't have a World Lipedema Day, so let's pick up one date. So and let's pick up the 11, because the number 11 resembles our legs that are so typical. And so through the advocacy page that Manuela took on on the benefit of all the patient advocates for lipedema in the world, we just made a proposal. It was 3 years ago, ladies. And so okay, we would like to propose the 11th of June as World Lipedema Day. Who wants to join us? And we didn't expect all of this. And yesterday, and 2 days ago, that was the 11th of June, that is now World Lipedema Day, it was so emotional to
Yeah.
see on every page, on the Lipedema Foundation page, on the Patient Association worldwide. It was so emotional to see
Yeah.
that three or four people in the patient world can change the
Yeah.
world. This
Yeah.
is so an example of what we can reach together if we just with simple good ideas taken at night
And then,
with the three crazy patients' head
yes.
that can change the world together.
Yeah, yes, yes, yes. It's amazing because everybody now is speaking about 11, and it's very good. And we have to work on for the officialization of that day because it's a very good idea, and we just have to move on to the official day for that. So it's already our official day, but it's not official. So we have to work on that as well.
I think that these results you can obtain only with enthusiasm. And I remember you the origin of the term, the Greek term enthusiasm. The origin is from the Greek words entheos emos, to have a God inside the blood. The God inside the blood there is or not. And if you have God inside the blood, these are the results.
Thank you. I think
Thank you for your words.
yes, I think that's a wonderful note for us probably to close on. What I would like to remind people is that we have another event coming up this month. On the 25th of June, it will again be at the same hour of 7 o'clock in Central European summertime, which is 6 o'clock in the UK, and so on and so forth. It's all in our publication. And you can find the details for that here. If you're on YouTube and you're watching this, then it's another scheduled live. You can click on it. You can hit notify me in case you're going to get caught up in something. And if you miss it, you can watch it on replay. It's going to be a great event. It's really particularly targeting our healthcare professional members. We have 4 different speakers, which is going to be an exciting challenge for me to wrangle them all. 4 of our board members, Dr. Gabriela Ferber and Dr. Corneli, who are both from Germany, Dr. Jose Luis Samaro from Spain, and Dr. Thomas Wright from the USA will all be coming together to talk about the use of GLP-1 receptor agonist medication like liraglutide and semaglutide, and to talk about there's limited research about it in lipedema. We had, I know in the Congress in Potsdam, I think one of the first conference presentations I saw on lipedema patients was delivered there by Dr. Amran and his colleague, I want to say Dr. Vaya, apologies if I've misremembered, in their early patient data. So we've got more patient data from people. We've got a lot going on in terms of early feedback, clinical observations, patient feedback to clinicians. So we really want to get everyone together and talk about what people's observations are, what their concerns are, what their questions are, what their thoughts are, what the patient perspective is on what's the role of what's branded as weight management or obesity medication in lipedema, and is that what I have? Is that where I am? So it's going to be an amazing discussion. We know it's super topical. So I hope that we're going to need a handful of us in chat moderating a really exciting evening. And we would really encourage everyone to join us here for that debate. I know it'll come up again in Rome at the Congress because medication is one of the topics. So if you can't join us online, watch us on replay. If you missed the amazing session 2 days ago with Dr. Paula Frederici from Abrali, Gustavo, one of the nutritionists who works with Paula and is also involved in Abrali, which she helped found. And we had one of their members, Marina, who is an absolutely amazing person. We had such a great session. It's a really long video, but you'll get so much from it. So please watch that. Look on our website, look at the Congress website. The Congress website is linked from our own website in our news and on our socials. So if you're not following us on LinkedIn, or on Facebook, or on Instagram, or on no, we're good at that, are we, Manuela? Okay, Manuela says
And
we're
also
good.
in our website as well. Your
Yes,
website as well.
yes, yeah. So follow us, share things with us, tag us in your publications, your media. If you're a member, send us information, tell us what you're doing so we can help make you even more successful. And I think, Dr. Michelini, we wish everybody a wonderful evening and can't wait to see them in Rome, right?
For all, thank you. A big hug to you. See
Thank
you
you so much.
very soon.
Indeed, indeed.
See
Ciao,
you, Ron.
everyone. And
Bye.
yes,
See you in Rome. I'm
see you
sorry.
in Rome.
Of course, see you in Rome.
Ci vediamo a
Bye.
Roma. Ciao a tutti.
Ciao a tutti.
Thank you.
Yeah.
Thank you.
Let me.
Ciao, grazie.
Yeah. Let me. One.
Bye.
And the stream should end.